The next age range, young adult, covers a spectrum of ages ranging from 19 to 44 years of age. The young adult concentrates on achieving career and interpersonal goals. The young adult has many responsibilities, often including work, marriage, and child rearing. The major fears of the young adult include loss of independence, being separated from their spouse, significant other, or children, and fear of losing a job in the event of illness or injury. Treat young adults with respect. They have the right to make decisions about their care and treatment. Don't be judgmental and support them even if they make decisions that you might not make. For example, refusing chemotherapy or pain medication. Transitioning through young adulthood to adulthood and middle age raises a new set of health and wellness concerns. Realize that middle-aged adults face the possibility of deteriorating health. Encourage visits from significant others. Respect their decisions and allow them as much control over their care as possible. Note that women go through menopause. Keep in mind that the amount of subcutaneous tissue begins to decrease and the skin begins to dry because of the decrease in the activity of sebaceous glands. Assess skin for dryness and for skin turgor. Encourage adequate hydration and use lotion to alleviate dryness. Blood vessel elasticity begins to decrease and cholesterol begins to rise. Bone density starts to lessen and osteoporosis becomes evident. Middle-aged adults experience vision changes. Their ability to hear high-pitched sounds decreases. The final age-specific care group examines the later adulthood and geriatric stages. As with all the age groups we have discussed, this final group has their own unique traits, especially when it comes to pain. For example, older adults experience a decrease in their neurons. Therefore, they may experience pain differently from younger or middle-aged adults. Ask them what their discomfort feels like. If you only use the word pain, you may not get the information you need. Ask older adults to tell you how they feel and to describe what is bothering them. Let's take a look at some other concerns for this age group. Keep in mind that cardiac output decreases, heart valves thicken, and the heart is less efficient. Monitor cardiovascular status carefully. Blood vessels are more easily injured. Note that thin skin and decreased subcutaneous tissue make older adults susceptible to temperature changes. They become cold easily, so protect patients from extremes of temperature. The muscles of respiration begin to atrophy and lung tissue is less elastic. Vital capacity is decreased. The patient should be given plenty of opportunities for rest between activities and procedures. Remember, elderly patients' bones are easily broken. Help them to change positions and to ambulate slowly and gently. Note that blood flow and oxygen to the brain is reduced. Remember that while memory is less efficient, confusion is not normal. Realize that the geriatric patient may have decreased ability to hear, especially high-pitched sounds. Note that vision begins to deteriorate and cataracts often develop. Be aware that older adults may need eyeglasses, hearing aids, and dentures. Older adults often lose teeth. Speak to the patient slowly and avoid high-pitched tones. Note that healing is delayed because the immune system is not as efficient. Remember that there is a delay in the emptying of the stomach and esophagus. Digestion and drug absorption are delayed, and heartburn and esophageal reflux can occur. Keep in mind that elderly patients often do better with small, frequent feedings in place of 3 large meals. Note that bone marrow function decreases. The patient's complete blood count, hemoglobin, and hematocrit should be monitored. Monitor I&O. Older patients dehydrate easily. Monitor and protect from infections, as healing may be delayed. Monitor wound healing carefully. Treat the geriatric patient with respect. Do not call them honey or sweetie, or treat them as if they're children. Advanced age does not mean that the patient is not capable of making decisions and being involved in his or her care.
Hi.
I'm Mary Simmons.
Hi, Mary.
What's your name?
My name is Masha Meringue.
Okay. Great, so why are you here today?
I have a very bad cough.
And how long have you had it?
A little over 2 days. My grandson came to visit me and he had a bad cold. And
Okay, have you had a fever?
I believe, yes, I have.
Okay, and is your throat sore?
Very, very
Okay.
sore.
Well, I'm going to have a look at your throat.
Okay.
In this scenario, the nurse remained at eye level with the patient and spoke clearly, slowly, and in a low-pitched tone. She was careful to treat the geriatric patient with respect.